So hi everyone. I have a special guest here today. He actually found my channel through some of the subtle Asian groups in on Facebook. So I'd like to introduce Wharton Chan. He is an MD PhD student calling all the way from Singapore. So he's a student over at Duke-NUS Medical School and did his undergrad at the University of Oxford. Um, his research background for his MD PhD program is related to comparative immunology. And fun fact about him, he performs in jazz venues and actually has perfect pitch, as it turns out. So, welcome, Wharton. Thanks for coming on to my channel.
Hi everyone.
So, I made a video a few months ago related to uh, sort of the differences between MD, PhD, and what's challenging about them, what's uh, difficult about getting into either program. So maybe if you can give us a general overview as to what um, uh, an MD, PhD program entails and sort of how you got started on this path.
All right, we start with talking about what an MD PhD program is like. So essentially, uh, in the American system, you have 4 years of medical school, and on top of this 4 year of medical school, in different ways, depending on the school, you would then have extra research time that is slotted in or going concurrently with the MD program, and this gives us the ability and uh, the opportunity to do science along with seeing patients and being in the wards. And the idea of doing an MD PhD is not to get an extra degree. It is to really dig deep into certain diseases or certain problems, or what we say unmet needs in the wards in the clinical world, and really zoom in and try to solve problems that cannot be simply done by observing patients, but rather requires a lot more other techniques that usually we can find in a laboratory. Yeah.
Awesome. Yeah, so the typically an MD PhD, or if you were to do programs separately, medical school, you would expect about 4 years of formal education. You take classes, go through clinical training, and then
Mm-hmm.
you graduate and move on to a residency. Whereas PhD, you spend your time taking some classes, doing research, and then defending your work on the panel of academic committee members. Sort of walk us through how this structure with an MD PhD program is different than if you were to do both routes separately.
Okay, so there usually is some kind of research component, whether long or short, depending on the school, within an MD curriculum. And usually, this MD curriculum would, this research portion within the MD curriculum would be very inclined towards the clinical sciences. So, what I mean by clinical sciences, it means that you're interested in looking at prospective studies or retrospective studies or case control studies, where you would look at patient data and ask a question. So, for example, we would say the classical kind of retrospective study would be you get a sample size of 500 breast cancer patients, and you look at like the cofactors that might be risk factors, like smoking or alcohol, for example. And for prospective, you have a question, and then you collect your patients, and then you do your studies, right? So these are very typical clinical studies. Like the golden paradigm of a clinical study would be a clinical trial because that's the highest form of evidence. And usually, medical students would be interested in these kinds of studies rather than any kind of studies that are either translational or basic. Whereas in a PhD program, not saying that you can't do a clinical science PhD, it does exist, and some people do it. But the idea of doing a PhD within an MD with an MD program is actually to be able to learn the skills of doing basic and translational science, and being able to dig deeper as to what certain diseases mean. So, for example, you are interested in being an endocrinologist and you want to study diabetes. And so these are the symptoms and these are the signs and the lab results of a diabetic patient. But what exactly happens within diabetes? So the first thing you can do is to look into a medical textbook and say that, okay, it is type 2, it's insulin resistant, etc., etc. But when you do a PhD, in a basic or translational science PhD, what you might do is, for example, feed a high-fat diet to a mouse, and then to induce certain kinds of diabetes, look at certain genes, or even look at certain interventions as well. So that is what a basic or translational science PhD would do. A clinical science PhD would be something like what are the different types of diabetes that we can see in a patient. So I do know a consultant here who studied an obscure type of diabetes that is not common, for example, for his PhD. And he would collect cases, describe it, and say what's special about it, and try to use a kind of a top-down approach to say that this is perhaps the reason. Whereas from a basic or translational point of view, it would be this is a gene. What does it do? It causes diabetes. And what is the mechanism? So it's a kind of bottom-up approach. So I would say that the different ways of approaching science from a clinical perspective and a basic or translational perspective, it's the way you look at it, and whether you go from humans downwards or whether you go from cells, animals upwards. Yeah.
Oh, that's a really interesting way of putting it. I've never really thought of it as like a top-down, bottom-up approach, which,
Yeah.
funny enough, it's the same type of terminology you use in my field when describing synthesis methods for
Mm-hmm.
different materials.
Mm-hmm. Mm-hmm.
But I guess just kind of to back things up a little, how did you end up getting started pursuing this degree? Did you always know you want to become a medical scientist, or did you accidentally stumble on this pathway? So kind of what's your story?
So it's actually more of the latter. Perhaps like you, Wilson, I actually wanted to become I wanted to become a scientist basically, and that's why in undergrad I chose to do biochemistry. So I went to Oxford, which is in Britain, and the UK system is such that you don't declare your major in your junior year. You declare your major when you're freshman. Well, rather you apply for a major, right? So, and there's very little, if any, flexibility towards the classes you take within your whole of your undergrad. So if I do biochemistry from day one, I'm doing biochemistry with a sprinkle of chemistry and organic chemistry specifically, and maybe down the road a sprinkle of pharmacology. But that's it. The crux of what we learn is what our degree is. So I had that mind when I was 18. I had that mind to become a scientist, and therefore I went for biochemistry. Then, as with people who like science, we do summer projects, we do like different research programs within the 4 years of undergrad, and there were two projects that I did that really stuck with me till today and became my expertise. The first one was looking at depression patients and looking specifically at the genetics. So I wasn't really interested in like depression per se. Although my mom's a counselor, so that kind of had like maybe a little impact on it. But I was very interested in genetics. I felt that genetics at that point, not now, but at that point, I felt that genetics was the cure-all of many things because it basically decodes, right? It decodes what we know to the smallest level,
Right.
diseases or whatever. And so it was 6,000 patients, and then we looked at what we call a genome-wide association study, which was very popular back in 2006. What this means it means that you have 3,000 patients of depressed, 3,000 of control. You then sequence their genome, and then you see what's the difference. So essentially, that's what it means, right? Nowadays, GWAS is very little power, or comparatively, we know enough in this field. So not a lot of people do GWAS anymore, the genome-wide association study. Yeah, but that's another talk. So that was the first project, and my second project was actually so in the UK when you do 4 years, so your last year is considered as your master's program. So I graduated with a master's of biochemistry, and my program was to my fourth year program was to look at different immune cells and look at their what we call human leukocyte antigen, which is very specific field of immunology. But anyway, I think the crux of the story is that both of my PIs in these two projects, they're doctors. They are practicing doctors. So the first one was a psychiatrist, and the second one was a general physician, internal medicine general physician. Um, and I noticed that the kind of resources and the kind of studies they do have so much more translational impact as compared to, I won't say so much more, but it has more immediate translational impact as opposed to some of the more basic questions that we do. So,
Right.
in my faculty, like my tutor, for example, he's an RNA biologist, and he looks at the very specific processing pathway at the end of an mRNA formation, which is called like 3' end cleavage. And it's really cool because he found an application, but it can remain basic because you can be just very mechanistic towards how you do things. For example, Wilson, for you, right? Like your synthesis for liquid metals. In the end, you can see it in making chips. Like there's an end goal towards that.
Yeah, there's like
But
a
in
practical aspect to it. Yeah,
Correct. But whereas like in when people study flies, people study worms, you study this gene and you think that it does this thing, but in the end, where does it go? It's very difficult to see that. So I actually never considered doing medicine in my first 3 years of undergrad until it came to the point where I was applying for PhDs. So I learned about my current school actually because my current boss, my current PI, he gave a talk in Britain. So I went to listen to his lecture, and so my current boss is called Prof. Lin Wang. He is one of the COVID heroes of the nation because we worked
Oh,
really
wow.
hard in this pandemic. But he's also known as the Batman because we work with bats, and he was the first one of the people who found that back in 2003 SARS was linked with the rhinolophus bat in China. So as one of the zoonotic emerging diseases experts, he played a really important role in the current pandemic. And doing feats like having the first FDA approved neutralization assay, for example, which is a big feat for us in the lab in 2020, etc. But that's another talk. So so he came to Britain to give a talk about his project and how he set up. So he is a scientist who actually is an alumni of UC Davis, I think, and then went to Australia to set up his lab, and then worked with bats for many years. Then he moved to Singapore to take up the directorship of a program. And yeah, so he talked about the medical school, and then I was like, "Ooh, this is interesting." So with having my PIs being physicians and having them talk to me about what it means to be a physician and what it means to do physician and to do medical work and also to do science, and having this knowing about this program and wanting to try, so that's what happened. So I then applied to do the MD PhD.
Wow.
It wasn't my single mind because at the same time I was also applying for a lot of many other PhD programs, so just PhD. So my other path would have been to stay in the UK to do my science, just PhD.
Gotcha. But,
Yeah,
this is probably the more interesting sounding route for you, so you decided to pursue it
yeah.
then, I
And
suppose.
obviously, there's also like other personal reasons, like family being closer in Singapore because my
Oh, for
family is in
sure.
Hong Kong, so it's a 4 hour flight away, and things like that. So like multitude of reasons. Then I decided to come here. Yeah.
Okay. So you mentioned that some of your work is related to some of the early, I guess, research efforts towards the new coronavirus that's
Mm-hmm.
been
Mm-hmm.
kind of affecting everyone's life at this point. So,
Yep.
like, what's your experience been like this past year? Like, I know lots of grad students, at least for my school, at least, labs had to temporarily shut down. Everyone had to
Mm-hmm.
like social distance,
Yeah.
and and these days like lab activity has resumed, but we're still sort of trying to figure out ways to be productive in these uncertain times. So kind of what was that experience for you like this past year, and if you had any either direct or indirect involvement with COVID research?
Mm-hmm. Okay, so very good question because in Singapore there was a 2 month circuit breaker. So this was somewhere between April and June. And what the circuit breaker meant was that the whole nation was in lockdown except for what we call essential workers. And essential workers would mean frontline healthcare workers, but also people who are doing research related to the virus. So in a way, our lab never shut down because we were deemed essential, and so we were given special permission to go back to work.
That makes sense.
Yeah. Uh, for me, I didn't directly get involved with the actual sample processing of COVID samples. That is actually done by another team,
Mm.
which also includes people from our lab, and it requires special training because dealing with the virus means that you need to work in a safety level 3 environment,
Mm.
which means that you gown up, you have your separate respirator and things like that. So that was like the essential portion in a way because they were getting samples from the hospital every day, then they were processing it, freezing them down for later research. So there was like a lot of crunch time because it also involved how do you contact tracing. Singapore is a very small nation in a way, so
Mm.
contact tracing has been proven quite useful in the pandemic. It was done very very well by the ministry as well. Uh, so my role, my personal role towards COVID 2 was a bit later after perhaps in the September timeframe when the lab was not the level 3 lab specifically was not at um full capacity in a way because the number of cases went down and the number of samples that came in went down as well, and so we started to get the opportunity to do research, which is different from like frontline sample processing. Is very different, right? Because that's really like a service kind of thing.
Right, right.
So we started to do research. Yeah, we started to research, and then at around November or December, that we then published this in vitro model with nasal epithelial cells. So basically, what this means is that we grow cells from nasal tissue, uh, and we differentiate in a way, get the stem cells differentiated, and then we infected it with COVID 2. Yeah, and just to prove that it is one of the models to look at it, and look at the different strains of not strains but different variants. Yeah, the different types of viruses really. Types, yeah, of viruses on the effects of it on the system. Yeah, so that included COVID 2. So that was one piece of work that I've done related to that. Yeah.
Okay.
As opposed to like the major effort, however, for our lab was, as I mentioned, this whole neutralization assay that our lab developed. So I wasn't directly involved in this, but like another team in the lab was doing this. And basically, what it does is that a lot of the, especially for serology, they test for the presence of SARS-CoV-2 antigen binding antibodies, which means that whatever is on the surface of the virus,
Mm-hmm.
if the antibody does that, then sticks to it, then it's positive. Whereas we developed this assay, which did not require cells, did not require level 3, is simple to use, and is also specifically looking at neutralizing antibodies. So it binds to the spike of the virus. And when it binds to the spike of the virus, it means that it cannot enter the cell, which means that it is neutralizing. So it's called CPASS, and that's the kind of the assay that our lab developed. Yeah,
Awesome.
so that
Oh,
was
that's really
I would
cool.
say the main feat of, yeah, that's the main feat of our lab for within this pandemic, and obviously many other things. We did like contact tracing and other things, but that would be like the major one.
Yeah.
Yeah.
And your personal work hasn't been affected too much then, right? Since you said you were an essential worker and you were able to still attend your regular lab schedule for the most part then?
I would say it was somewhat affected because the whole lab basically shift gear to do pandemic. So in the
Right.
infectious disease field, there's like this very common way of saying that there's wartime and there's peacetime, and
Mm.
wartime research
It's
is
an
very
interesting way to
different.
put it.
Yeah, wartime research is very different from peacetime research. So like, it doesn't matter what kind of project you're working on. Like, are you working on viruses? You're working on immunology? It doesn't matter. Like, if it's wartime, it's a team effort. Fight the pandemic in any way possible and do the research for the pandemic. Yeah.
Yeah. So, this might be something you already are familiar with, but so when the pandemic started, like a bunch of these publications started coming out just in
Yep.
droves because everyone wants
Yep.
to see the
Yep.
latest research. And I think what accelerated the vaccines that have come out from both Pfizer and Moderna and
Mhm.
University of Oxford,
Mhm.
and what sort of was one of the main driving forces was mapping out the protein structure for
Mhm.
the coronavirus. And
Yep. Yep.
this work from UT Austin, working with cryo TEM, so cryo
Yep.
transmission electron microscopy,
Yep. Yep.
was one of the first papers that came out. And I think it came out in Nature or Science or one of the top tier journals, but
Yep.
it was one of the first reports um, on mapping the actual protein that sort of served a precursor um, to developing the vaccine a lot sooner than was
Yep.
expected.
Yep.
Um, so I'm sure like that's probably work that you're quite familiar with at this point, or at least like kind of something
In the periphery. In the periphery.
in the periphery then.
Yeah.
And it was, I think, well, one of the PhD students in that group who apparently recently defended his thesis got a lot of attention for that. So
Okay.
definitely a good plus for his career at the very least. Um,
Yeah.
but yeah, I think just being able to, contribute not only to science, but something that actually helps people is very noble. It's something very admirable
Yeah.
and something that I aspire towards as well. And do you feel like you've contributed your part to advancing this general area and helping to maybe improve the whole situation?
Mhm. I think for sure. Uh, I'm happy to have like contributed in this pandemic, towards the advancement of the science and things like that. And I think that it is because it's wartime. It is incredibly opportunistic area, incredibly opportunistic because the moment you have the word uh, SARS-CoV-2 or COVID-19 in the title of your paper, it is a different ballgame. It's a different ballgame because it will be an accelerated review. It would be you have to publish a preprint. It would be, um, a lot more scrutiny. People are very cautious of the data now. As the pandemic progresses, as at the start of the pandemic, anything goes, right? But now
Right.
people are having a lot more scrutiny towards COVID-2 research. So it's important to do good research, not just the ride the wave in a way, and cruise along. So my overall sentiment with COVID-2 research would be that it is important to contribute to knowledge, but don't rush. Like, yes, it's so competitive because everyone might have the same idea, but make sure that the data is sound and make sure that the stats is done properly because it is simply sometimes it's simply appalling what comes out. Yeah, in the general area.
Yeah,
So
no, I agree.
yeah.
And, there's like a statistic out there that says quite a few peer-reviewed articles out there are total BS. Like
Mm-hmm.
they're probably data is not very adequate, but they still get published anyway. So something to watch out for just in general for most people. You haven't personally encountered any papers you felt were relatively bad COVID related papers. Have you?
Mm, there's quite a few. I won't name names. Yeah. Yeah. That it's very important to filter out the what when you read and be like really scrutinize what you read as well. Uh, I think the other important lesson that we learned in this pandemic with regards to research is that the 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 impact of preprints in the media is crazy. So even when you submit and it's not the final draft and you haven't done your rebuttal, be careful about what you write. Because the media will catch on to a preprint, think that it is a published article, and in fact it isn't. A lot of the media now is being smarter in the way that they say that this is only from preprint, from bioarchive or medRxiv.
Mm,
But it's very important that like it can just go out of hand, right? Um, like for example, there's I guess one of the most hurtful things or the most depressing things towards science in this pandemic would be really the conspiracy sentiments of a
mm,
lot of the stuff that we do, whether it be anti-vax or anti-bat, really, because I'm in the bat field, right? So there's so many people who said that like, oh, it leaked from China, you know, but experimentally and also looking at evidence, you know that that's not really possible in the first place. Um, so it's blowing like at the start of the pandemic. Even in China, it's not just like anti-China. At the start of the pandemic on WeChat, for example, like there have been so many articles floating around about saying that like, oh, the pandemic was done by these virologists working on these viruses, leaking it out from a level 4 laboratory, um, and I just felt so bad for like these people, these virologists who worked so hard to contribute in the pandemic, in the end getting this kind of result. Obviously, you start filtering out, yeah, at some point, but it does impact
yeah,
lives, you know.
yeah,
Yeah.
yeah.
So that, yeah, that's just bad in a way.
Yeah, and we can have an entirely separate conversation on the merits of fact finding and science literacy and just having people informed and people actually listening to scientists and doctors and
Mm-hmm.
not
Mm-hmm.
treating things as more of a political matter like they do in my country, unfortunately.
Mm-hmm.
Um, but again, probably a different conversation on that.
Yeah.
But
Yeah.
I guess let's switch gears a little bit since you mentioned you've had your education in two different countries. Sort of maybe give us your take
Three
on
now, actually.
three. Yeah, oh, of course.
Yeah.
So,
Yeah.
what are like the notable differences between doing science programs between Oxford and your school in Singapore? And do
Mm-hmm.
you have any uh, comments on kind of what challenges that you face in terms of what you're going through in your current program right now?
Okay. So I can only extrapolate. Obviously, I'm not doing my PhD in Britain, so I can only extrapolate what I know from observing other PhD students when I'm in the UK, and also my best friend who has just defended, who actually is a structural biologist.
Oh, nice.
Coincidentally, yeah. So I guess the major thing is that in the UK, you would let's talk about funding first. That's the most realistic and pragmatic
Yes,
thing that we have
everyone
to
wants to
talk
know
about.
about funding.
Everyone wants to know about funding, right? So in the UK, you have to apply for studentships, and what this means is that like it can be from Medical Research Council (MRC), it can be from Wellcome Trust. These big funding bodies have their own funding programs for PhD students. So you will apply for that. That sometimes it's tied to an institution, sometimes it's not. You get through the interviews, you get the place, then the institute would take you, or it's a separate process. So it can be separate, it can be together. But usually, like for example, in my old institution in Oxford, the Wellcome Trust Human Center of Genetics, there are multiple PhD programs within the same institution because it's just from different funding bodies. So it can be MRC, it can be Wellcome Trust, um, and that's what's going to pay your stipend, right? So and that also dictates how long your PhD is. So if it's a small funding body like that doesn't have as much money, then what they would do is that your PhD length would actually be shorter. So there are actually 3.5 years of 3.5 year studentships that exist. So what you either finish within 3.5 years, which is really really rushed, or your PI would pay for whatever extended time you have to finish your PhD. So um, that's how PhD works in the UK in general. I would say in terms of the science, it's probably similar in the to the rest of the world from the UK. Uh, and in terms of research landscape, this is not just from a perspective of a PhD student, but just research landscape.
Mm-hmm.
Uh, Big nations like the US and the UK, they have a lot more history and a lot more fundamentals to support basic science, right? And this is just my personal observation. And Europe as well. They don't have to see results immediately, um, because basic science doesn't offer tangible results a lot of the time. As I said, it's a bottom up approach.
Right.
So you can be working on this DNA binding protein that only contributes to a very small piece of the puzzle, but you're an expert in the area, and that's completely fine.
Mm-hmm.
Whereas in small nations, science is not just academia; it is tied to industry. It is a whole bubble of its own. So Singapore is a very very strong example of this in that it not only pushes people to do science that has medical impact. Not saying that basic science is not important and that it's not done here, but it's um, relatively scarce, I would say. And there's like this whole industry connection that the the general sentiment is heading towards, either industry or medical in my field. So the do your research in a way for your topic of interest before you start your program. That's general advice, right? But the the country sentiment is also very important. Yeah. Um, I think I saw this article earlier on about like the funding for mathematicians, like really pure mathematicians in the UK, and how
Mm-hmm.
it's like dwindling a little bit. But whereas some of the greatest mathematicians have come from Britain, so it's always like a struggle because solving Fermat's last theorem, it's a millennial problem, but where does it go? And
Yeah.
so if you're a small country, you you might have the vision for it, but you might not have the means to fund that.
Yeah. That makes sense.
So the allocation of resources is very very important in that way. Yeah.
Yeah. And
So
yeah.
yeah, that's what I would say is like for the funding side. Yeah.
Yeah. But have you, I guess, encountered any significant challenges within your program, or do you feel like you navigated it pretty well so far, or at least for however many years you've been part of it?
Sure. So let's not talk about the medical side, right? Let's not talk about MD first. Let's just talk about the PhD portion.
Sure. Sure.
Um, uh, the science has been okay so far. Uh, I guess it really, again, general advice. It really depends on your lab, because people from small labs and people from big labs function very very differently. My lab is quite big, and I'm in a very limbo position in a way that I don't have an immediate postdoc supervisor.
Hmm.
So a lot of the stuff I do is quite independent, and I think that's really where the challenge is. But it's also where what I like about my position, because it gives me a lot of space to explore. But it also means that I have to find the right people to ask questions. Um, Many times it will be people outside of the lab as well. Yeah. So I guess that would be my biggest challenge. And coming from an MD PhD perspective, this is quite important. When you start your PhD portion as a medical student, the first thing you would ask yourself is, how does this tie back to residency application? like very pragmatic, right?
Yeah.
Um, like let's say you want to be a an endocrinologist, right? So you would do an endocrinology related project. You would do thyroid, you would do diabetes.
Hmm.
Very natural progression. But the advice that I have received from both the MD PhD office, but also from my seniors, is that it's the skills that's more important rather than the topic area. Because who knows what kind of residency you will go in? Like it will change, and this really changes across medical school. You start as a medical school freshman wanting to do orthopedics, but you end up doing internal medicine. That's just the reality. Things change
Yeah.
because of your working environment, because of how you like to handle patients and the kinds of cases you want to see. It
Hmm.
changes. So, and especially if your PhD is within sandwiched within your whole medical career, it is simply not worth investing so heavily in one topic unless you're very certain. And so some people have done that. Some people have actually informed their residency choices through the kinds of science that they've done. And so this is always an important question to ask yourself when you start choosing your PhD programs. Yeah. Uh, I would say there is nothing wrong, absolutely nothing wrong in doing something that's very basic science in your PhD as an MD PhD. Some people have just learned about certain receptors uh, that is not really tied to any diseases. But then the kinds of skills that you get, like knowing how to do a Western blot, knowing how to determine structure of a protein, knowing how to interpret mass spec data, for example,
Hmm.
these are all skills that are important later on as you zone in on something that you're interested in and you want to solve the problem on. So, uh, in the words of my MD PhD director, the PhD you don't need a PhD to do science in the medical world. There are many good scientists out there who just hold an MD. But what the PhD provides you is a very solid chunk of time that's protected, and highlight the word protected because it protects your time to do research, right? And you don't have to care about anything else aside from certain clinical duties that will not be as heavy. You know, uh, this protected time would get you your first publications, would develop your skills, would develop your network, and that is the really solid chunk of time that is required to further your career. Whereas very often when you see MDs who do good science, they partner up, right? They partner up. They provide tissues, provide samples towards a good scientist, and they work together. And there's nothing wrong with that. There really isn't. But know surely what kind of not surely, but think about what kind of clinician scientist you want to be. And
Yeah.
I guess that is really the number one question as to why you will want to do an MD PhD. If you say, "Oh, I want to save time. I just want to do an MD," and then later on I would find research opportunities. Yes, of course, that's fine. There's an NIH grant and also a mirror of that here. It's called a transition grant, right? You
Hmm.
transition from an MD towards to being a clinician scientist, and of course the kinds of skills you have would be limited, and therefore the kinds of questions you would ask would also be different. Like it would be much more clinical oriented. But if you want to be able to zone in for that, then the PhD is a recommended way or one of the ways to do it. Yeah.
Yeah. Not honestly, those hit a lot of really solid fundamental points, and I could not have said that better to myself. So I really appreciate that. And you're right. It's like a lot of times people can say PhD students can be a little obsessive, maybe self-absorbed in some sense, but a lot of times it's because you're tackling a problem and it's probably something that you maybe without even meaning to, you sometimes think about, like even when you have left the campus or off doing other things. And it is an interesting time in a person's life when they go and put themselves in that sort of environment. So I
Mm-hmm.
totally understand that. um, I guess in general, like what's your overall goal? Like what do you plan on doing afterwards?
Mm-hmm.
Since I would presume that you will likely go on to medical residency, but
Mm-hmm.
I mean, do you have any specific plans?
So there's this saying in medical school that when you go through clinical rotations and when you go through your clinical time, what you do is not choosing your area of specialty, but ruling out your areas of specialty. Like you rule out things that you don't want to do. And I know
Yeah.
very certain things that I don't want to do, right? But have that. I know that I'm an internist or internalist, both works. Uh, I'm not a surgeon for sure because it takes a certain kind of persona, a certain kind of grit to become a surgeon. And within that, then I'm still open because I feel like being an internal discipline would allow me to marry the research a little better. Not
Hmm.
saying that surgeons don't do good research, some surgeons do, but I just like that mode a lot better. So I'm still just keeping it at that at the moment. I'm not entirely sure whether I will go into infectious disease, which is the field I am now, but it would make sense in a way, and I still am interested in it, but I won't rule out anything else within the internal disciplines. Yeah, and I can handle kids, so pediatrics is still on the list as well. Yeah, so I guess that's the kind of thought process that most of my classmates have. Um, the the lonely part of being an MD PhD is that most of your MD classmates would have graduated already. So my all my MD classmates currently they're what do you call it in the States, interns now
Yeah.
in hospital, right? So uh, and then they're tackling problems like people are dying in front of them, and then ECG is going flat and things like that,
Yeah.
and you're in the lab still tackling this problem. So that's one of the things you have to reconcile in a way. Yeah.
Yeah.
Another thing that I would want to kind of point out is that there's this really recently there's been this saying about uh, whether it's worthwhile being a reductionist in as an MD PhD. So what
Huh.
this means is that, like, as I said, right, if you study a gene, you study a protein, and you understand everything about it, then you look at everything else that's around it. It's a reductionist approach because you're trying to say that this player is important. I understand everything within this player, so you reduce all the information to one of these players. Then you extrapolate what happens, right? Whereas the other kinds of other approach would be more of a holistic or systematic approach, where you say that this is the environment. We probe across many different markers, and you try to understand that. So as a scientist, a reductionist approach is what we call, what I think you will agree with me, but it is very elegant because it is logical, and you really can understand many things about one thing, which is what most PhDs do. But as an MD PhD, would it then benefit yourself in looking better at the bigger picture
Mm.
than to know something that's very specific? So I'm not saying this is not this isn't even in the divide of like a basic science, translational science, or clinical science.
Hmm.
It is an approach and the way that you look at something. Like, is it more worthwhile to look at the physiology of kidney disease rather than to look at one receptor within the kidney? You know,
Right.
they're both basic science problems, but the way that you approach the problem is very different. And because of increased computational power and biotechnology, we are now in a position where it is possible to look at it in a more systematic approach. There's nothing wrong with a reductionist approach because it's elegant and it builds up to a very good thesis.
Hmm.
But as a medical personnel, would it then benefit yourself better in looking at it the other way? So that's the question that has been in debate for the past few years, and I've been hearing this term a lot about being a reductionist or not, because as an MD PhD, know what your needs are, because your PI very well might not be a physician,
Hmm.
and when it's not a physician, when he or she is not a physician, then he would not know what kinds of projects would suit your needs the best. And so fight for your own project. I think that's another advice that I would have. And one more thing would be, because you would have done some kind of clinical rotation or even not, who knows, depends on the structure, right, of the medical school. Before the PhD, you are entering the PhD arena with an advantage of being a generalist, right? So you would have done internal medicine, um, you would have done surgery, you would have done psychiatry. You know a bit about everything, but not in depth,
Mm-hmm.
right? Whereas someone who has done like research on this receptor in undergrad and continues to do receptor on that for your PhD is very, very focused. And
Yeah.
so your advantage of being at first an MD then a PhD would then be being a generalist, and therefore use this advantage strongly by looking at things that can potentially be interdisciplinary. Yeah, because that really is it's the future, right? Um, and I guess this is when I interject a little bit of my story, my personal story as well, because when my tutor in undergrad, he's an RNA biologist, but distinctively remember in my second year, he just in passing he said, so he at that time he became the manager of a sequencer, right? So like sequenced RNA, he became the manager of that machine, and he was telling us the difficulties of managing that as a biologist, right? Because it is technical, right, and it involves computation,
Mm-hmm.
right? So also, I'm sure you handle a bit of computation as well, like and you would definitely also agree that in this day and age, whatever kind of scientist you are, you should know some coding, right?
Yeah.
And right, like it's just inevitable. And I remember him just saying in passing, guys, learn Python, right? Just that's just what he said. But at that time, I really took that advice to heart. And so, there's just so many ways to learn coding nowadays, like I don't know, different MOOGs and things like that.
Yeah.
So what I did was, my first project was a computational project, the depression one, because I said I'm going to learn coding by finding a project that forces me to code, right? And so fast forward now, I'm doing a hybrid project, what we call like a wet lab and a dry lab project that
Mm-hmm.
like intermarries the both of them. Caution though, for people who think that that's the best of both worlds, you need to juggle your time very, very well. Yeah, it's not easy. Right? It really isn't. It really isn't. But um, you know, uh, being interdisciplinary means that you position yourself to become a very good communicator between specialists. And that is something that's very important, because as a medical professional, you get access to patients and then you get to work with other colleagues who are pure medical doctors, right? But at the same time, you have a research mindset, and
Mm-hmm.
then you can then work with the stats people because you know a bit of coding, right? And also you can work with the experimentalists who work in the lab like all the time. Collaboration is the future. Interdisciplinary areas are also the future, right? So the then putting yourself in projects that allow you to do these is one way to make yourself relevant, in my opinion, right? Yeah.
Yeah.
There's no one way to do it. And in the end, the biggest question is what kind of clinician scientist you want to be. Because in the lab next to me, the PI, he's a medical graduate, right? So he's an MD
Mm-hmm.
in by on paper. But ever since he finished medical school and finished his internship, he just did science, right? But just the fact that he had that piece of paper meant that he was able to communicate with doctors a lot better, because they feel like you're one of the herd.
Yeah.
And
That makes
being
sense.
able to do that meant that he was able to have very good collaborations, do clinical trials. So that actually he did the local trial for vaccines, for the COVID-2 vaccine, and that's one way to do it. So you have full-time science who has a piece of paper, let's say you're MD, full-time MD who works with scientists and has idea and contributes samples, and you have something in the middle where like, oh, I do clinic once a week, right? And then the rest of the time I'm in the lab, or vice versa, right? So the word clinician scientist implies a spectrum, and the most difficult thing of being an MD PhD is finding where you fit in that spectrum, because there is no one recipe that works. And it depends on the topic you do, the institution you're in, the people you work with, and your support network. So determining that is a long journey, because you won't get that answer within your PhD. You won't get that answer even after you graduate. You will only get that answer when you get your first grant, um, after you go into residency, right? That is
Yeah.
the reality, and so that is really the big toughest question to figure out throughout this whole process.
Yeah. And you know
Yeah.
what? It's probably not something that anyone will really find an answer to because you have such a broad spectrum of so many different fields in science and medicine that you just don't know exactly where you fit in that map. And
Mm-hmm.
wearing different hats, kind of what you were alluding to before, like coming in with a very broad sort of jack of all trades skill set and being able to apply yourself in different fields that is the future. That is something that needs to be more prevalent in academic and scientific training because like take my field for example, like material science and engineering is uh, a giant agglomeration of so many different areas. Like you study physics, you study chemistry, you study electrical engineering, mechanical engineering, computer science.
Mm-hmm. Mm-hmm.
Computation is the big thing because we have supercomputers that are trying to predict new material crystalline structures before
Mm-hmm.
we even figure out the ways to synthesize these materials. So it's uh, it's an emerging, growing field that, despite like whatever field you get into, um, it's something that allows you to put on those different hats.
Mm-hmm.
So I'm glad that you have that approach because it's like it's definitely something that would be necessary for someone who might not want to be super specialized but can still kind of talk in the different languages of
Yeah.
different groups of people. So I think
That's a very good way
that's
to put it. Yeah.
yeah,
Different
yeah,
languages for sure.
yeah. No,
Speak in C plus plus.
yeah, I think so. Python was actually the first programming language I learned. Well, actually, no, scratch that. It would be MATLAB, but technically, it's not a programming language.
It's an
Um,
engineering language.
Yeah, and you know what? To this day, I'm still not very good at MATLAB. But Python is useful, and it's definitely a language that is used pretty heavily within material science. Um, and it's easy to pick up for most people. So like, kind of going back to some of the coding resources I used, I think CodeAcademy.com is
Yeah.
always
Yeah.
a nice one, and there's so many free resources out there. So
Yeah. I
people
did
need to pick that.
Coursera, Udemy, all
Yeah.
you name it. Yeah,
No,
but I
yeah.
guess with that, like for any of the viewers who want to start learning coding, find a project. That's always my
Yeah.
advice, because
Throw
it's
yourself in the
so
fire.
dry. It's so dry to, like, just go through like examples of codes. Like, have a project, then you can apply it, and that's really how you learn the best. Yeah.
Yeah, my significant other, she asked me because she's using Python right now,
Mm-hmm.
um, and she asked me, would it be faster to do this Excel spreadsheet data mining by hand? It's just more looking for information and helping to organize certain things, or should she write a program to help organize that information? I told her, just write the program. It might take you longer to do that, but you build the skill to do it, and then eventually if you need to do something better or faster, at least you'll have some experience in helping to craft whatever project you're trying to do. So
Or bigger.
yeah,
Sometimes
yeah,
that's the problem.
or bigger. Yeah,
Yeah.
it's and like it's certainly a very lucrative field. So if you don't want to do MD, PhD, or material science, you can always just become a software engineer.
Actually, so that was actually what so if I did just stay in the UK and did like a PhD, I specifically found, like, looked for bioinformatics kind of PhDs, because I told myself I need a second option. In life you always need a second option, and that was actually what I was thinking, because a lot of I've seen quite a few postdocs who went to industry simply because they have handled projects that handle big data, uh, and it's still, you're still employable in that way, and you're not just an expert of NLRP1,
Yeah, yeah,
some receptor, or some gene, So
yeah.
it's these translational skills are definitely important, whatever kind of PhD or MD PhD you're doing. Yeah,
Yeah, and you know what, like the what I like to tell people is that like or at least on the PhD end, like not everyone's pigeonholed into like a specific topic. And the way I tend to see it is that you sure you become like an expert of a small slice of your field, but ultimately you become a problem solver. You become a very good
yeah,
problem solver,
yeah, yeah,
hopefully.
for sure.
And you figure out how to break problems down to like a first principles approach
Mm-hmm.
in some aspects and figure out how to solve those problems a lot faster than say if you hadn't gotten that type of training.
Mm-hmm.
So you're never specialized, and I think that if anything, it opens more doors for people
Yep.
to go into
Yeah.
different fields.
Yeah.
Like I know some people who decide to not do science altogether. They go into consulting, they go into finance
Yeah.
on other fields. Whatever makes you happy, I suppose.
Mm-hmm. Mm-hmm. Yeah, for sure.
Yeah.
Yeah.
Any last advice you'd like to give people who'd like to join an MD PhD program,
Uh,
or words of discouragement to get people away from the program?
don't do the program because you want an extra piece of paper. Yeah. Um, and do make use of your PhD to build skills that you will never find the words, and build a good network with scientists so that they can be your collaborators in the future. I think that is super important. Yeah. Because being a PhD means, okay, being, as I said, like my the lab next to me, right? His piece of paper made a difference because he can do trials with clinicians. But it works the other way, right? You're an MD, but you're also a PhD, and like being a PhD means that you know you are friends with scientists as well. And if in the end you decide to just practice, but you have this problem and you have this sample bank, then the context will become important. Yeah. So those are all very important things to consider. And in the end, have fun. Very important. Have fun in your PhD because the pace is so different. Um, in the wards, you see patients, you solve problems, make changes. Uh, it's diagnosis, management, discharge, right? Um, it becomes very routine in a way, but obviously it's challenging, but it's routine,
Yeah.
right? Whereas in PhD, it's so much exploration, right? Although you can argue that like you have an experimental plan, you just execute it and you think,
Yeah.
right? But yeah, it's a different pace. So enjoy the different pace that you have. Like outside of science and like medicine, right? Just being in the PhD portion is probably like the happiest years of your whole medical career because you don't have to have night calls. You don't have to, go to the wards at 6 a.m. and round and things like that. It's a tough life to be an MD. Obviously, it's tough in another way to be a PhD because so many things are uncertain, but it's, you know, the balance is different. So, yeah,
Yeah, I
enjoy
agree. I
that.
think that the uncertainty scares some people for sure, but at the same time, like even if you have structure and you kind of anticipate what you're planning on doing, sometimes the workload's just too much.
Hmm. Hmm.
So yeah, I think that's a good note to leave on. And if anyone is interested, I'm gonna leave LinkedIn contact information for Wharton in the description below. And
Or
again,
just I'll just pass you my email actually. Yeah,
oh, okay. Yeah,
yeah,
send me that and then I'll just include that in
yeah,
the
yeah.
description. But thanks again for dropping in and contributing your thoughts. It was like really interesting to get that different perspective and hopefully this advice will be useful for somebody. And
Hmm.
I think
Yeah,
that's all that matters, just
yeah.
getting our experiences and message out there and whoever wants to listen, then they're
Yeah.
more than welcome to.
I think one last thing.
Yeah,
I would
go
want to
for it.
add,
Go for it.
talk to more people. Really, like I think in your like definitely you echo the sentiments in your conference video as well, but talk to more people. um Physicians, scientists, it doesn't matter, talk to more people, because building that network, on top of building that network, you get to understand what kinds of work other people are doing and how you can mimic or learn from that. Yeah, don't hole up in your lab as much as we want to, because sometimes it's just what you need to do, and like analysis is a focus task.
Yeah.
Yeah,
No, I
but
totally agree. And
yeah,
you'll be the first of many, and
yeah.
hopefully more interviews to come. And if you'd like, honestly, follow up in the future just to see where you end up and
Mm-hmm.
kind of what new things that you have to talk about. So
Sure,
you're
yeah.
more than welcome to come back.
Okay.
All right.
Thanks so much, Wilson.
Yeah, thank you, Wharton. And
Okay.
remember to drop a like on subscribe button, and I will see you guys on the next one.